Hi everybody, I'm here today with Hugh Gilchrist, who is our remedial massage therapist here at the Chiropractic Domain. Hugh has been with us since last year, and he is not just your typical massage therapist. He has some additional skills. One of them is myofascial release. And we thought we'd just record a little bit of information today to teach you a bit about it and invite you to consider maybe putting yourself under his hands. So welcome.
Thanks, Paula.
Thank you. Now, not many of you know much about Hugh's background, but Hugh, you did a couple of other things before you came to remedial massage therapy.
Yeah,
I
spent 5 years as a claims manager in long-term claims at WorkCover.
Wow.
And then I spent a few years as a carer with kids with cerebral palsy and Down syndrome.
So you would have seen people in two different spectrums, I suppose, dealing with chronic issues, either work-induced injury or, I guess, in disability, something that they may have been born with and have to find ways to manage. How did that make an impact on your
absolutely.
decision to move into this area?
Yeah, so my time at WorkCover, it was the first time I'd seen people that had physical injuries that over time turned into emotional issues as well.
There's a lot of stress involved.
Absolutely.
With an injury apart from the actual pain.
Look, from the rehabilitation to the legal intervention and the pressure to return to work, also not having perhaps the same job available to you anymore. It's a lot for people to digest. And
so I guess you decided to take matters into your own hands, I suppose,
yeah.
And that wanted you to be that person to help.
Absolutely. I did some travel and I came back, and I guess I was a little bit lost on what to do with my own life, and so I just decided to do massage, and it took on a life of its own.
It lit that fire in you.
Yeah, absolutely.
So when people think about remedial massage, I suppose most of us would be considering the oil and the hands-on and the working the muscles, and sometimes deep work, and sometimes it's tender, sometimes it's painful, and sometimes it's kind of good that it releases. And certainly it's something that I've used over my whole career to complement the chiropractic body work that I do. But Hugh's got some additional skills, as I mentioned, myofascial release. And perhaps first of all we should talk about what the fascia is. So my understanding from when we learnt anatomy was we have various layers from our skin down to our bones. So we've got skin, and then we've got the subcutaneous layer, which contains the fatty tissue that we have, and then we come down to the fascia, and then we come down to the muscle. And the fascia is kind of like a glad wrap that covers all of the muscles in our body, and it's quite unique. We don't, you can't easily see it. It's a bit like cling film, and it actually is supposed to glide nicely, but if you actually put glad wrap on top of glad wrap in real life, it just kind of gets stuck. And that's a good example of when you've got an area of the body that doesn't move, the fascia also can get stuck and not glide. So when I've had some myofascial work prior to meeting you, and not too many people have done it, I understood it was about gliding and trying to get a movement at a different plane perhaps than to what I might do with adjustments.
It's working with the body. I'm not doing things to the body. I'm working with the tissue. So
that might be your holding, your guiding, your allowing passive movement.
You spend enough time sitting with the tissue, and it starts to get warm and hot and pliable, and then once it's in that state, you're able to use it to realign the posture or to unwind a part of the body that's not free or moving quite as well as the rest of the body.
So the nerd in me also thinks about the nerve system and the brain sort of pattern of that, and with what I know when Hugh does his mobilisation and holding and sometimes pressure work, is that it's actually trying to wake up the part of the brain that's forgotten how it can move in that way. And sometimes we stop moving in a certain way because we associate it with pain, but when Hugh's doing this work, he's holding and supporting gently, safely, reintroducing movement that you may not have had. And I notice when you do it, you're concentrating and you're breathing and you're getting into a zone. And is that to also, I mean, obviously concentrating, but to help people switch on that calmer part of their nerve system as well?
It's partly that. It's partly to remind the clients to also breathe. And just a simple change in your breath work and your state of relaxation.
I guess particularly because people often will tense against the pain, and they forget how much they're tensing up.
And because we're working with the fascia and I'm not doing things it can be an unusual sensation. So the mind and the body is sort of like, what's happening? This feels strange.
And I notice when you've been doing it that you often start with the myofascial release, and then sometimes there's some residual body work that you actually do need to do and work through a little bit with some oil, because when you're doing the fascial release, it's not, you're not even involving oil, you're this movement sort of stuff.
Yeah, once there's oil on the body, I'm limited in doing any tissue work because my hands just slide over the body. So
it's quite a unique combination.
It is. Yeah, look, it is.
So we've sort of been chatting over the last few months about the work and the people that we've both been working on and some of the really good things that we've seen. And so Hugh's decided he's going to offer a little introductory kind of appointment, and it's going to be a 20-minute appointment. And we're just capturing that at $30, so it's not very expensive. And you'll be targeting things for people. Just tell me a little bit about how you might do that.
We will be identifying a specific area of the body that you've got some concerns with.
Like a neck, shoulder,
could be lower back, could be hips.
Hip,
We'll do a full body assessment, postural assessment. We'll look at a few different aspects of your life and how they'll link together whilst applying the techniques. And then I'll give you lots of things to take home with. And that
homework.
Can be, it's different for everyone, so it's really well tailored.
So we'd like to invite you to have a think about that work, particularly if it's new to you. Certainly the people that have come through with Hugh in the last 6 months have been, yes, it is different, but it's good different, and quite surprised at some of the changes, and they tend to come out a little bit floaty, which is nice, more so than floaty from my adjustments at times. So we'd like to invite you to do two things. Hugh's actually done a few little clips of some of what it looks like, and we're going to add that as a link that you can click on and have a look at. But also, if you're interested in trying this 20-minute introductory offer, we'll be running that for March and April to give people a chance to test you out, see that what you do and how much it might be beneficial to them. So you can click on one of those links below and you can book yourself in, or simply just ask Lisa or Lynn at the front desk and they can help tee that up for you. So look, thank you for your time. That was lovely, and we'll see you all soon. Bye.